Afternoon. I'd like to introduce Kurt De La Valle, who is a postdoctoral fellow at the National Cancer Institute, talking about pollen exposure and its role in asthma exacerbation. Kurt, does exposure to pollen trigger asthma?
I think that, well, the short answer to that is yes, but with a couple of caveats. One, obviously, the individual has to have asthma and fairly probably active asthma, I would say. And of course, they would need to be allergic to the specific pollen. So just because there's heavy tree pollen outside, if you're not allergic to tree pollen, it's obviously not going to trigger an asthma attack.
And it's not likely going to be a first exposure to anything. Their first asthma episode is not likely to be triggered by pollen?
Well, I mean, like any other allergen, you need to be exposed first before you develop the allergy, and then after you have the allergy, any subsequent exposures could trigger an event.
So which pollens are most important?
Well, not to dodge
or
the question.
Likely.
not to dodge the question, but that would depend on the individual. So any pollen that the individual is allergic to is, I would say, equally weighted in terms of being able to trigger an asthma event.
Okay, and are there effective ways that we can reduce exposure to pollens?
I think so. Perhaps doing something simple as maybe avoiding times outside when you know pollen levels are high, or some simple modifications in activity patterns when you are outside. Maybe not engaging in rigorous activities when you know that certain pollen levels are high. To more complex things like getting air filters or using air conditioning in your home to filter the air and keep a somewhat clean environment that way.
Are there simple ways to tell which pollens are at high levels when?
Well, pollens are publicly reported, so you can usually get these with any weather report. There usually is an air quality report, and pollens are generally included in that. So you have at least some degree of what the pollen counts are in your area on any particular day.
Okay. So anything you want to add to that? Or are we done? Those are my 3 questions that I have for you. Have we covered all of the material that you would like people to know about pollens and exacerbations, or?
I mean, I guess I didn't use any of the slides, but yeah. I looked at the questions beforehand, so they seem pretty basic. You know, just does it trigger asthma? I mean, that I think the evidence is pretty clear as long as you're allergic to the pollens. And I said, like, sort of the second question was, you know, there's really no answer to that other than just, if you're allergic to a pollen, then it's an important pollen, right? It's not so much like
that makes sense. So it depends on the individual very much.
Yeah, I mean, sort of unlike some of the air pollutants you probably had other people discuss today, those things are not they're not causing necessarily allergic reactions. So there are, like, you know, certain gases or certain pollutants that are going to be of greater effect or just of greater abundance. But in the case of pollens, like, it's, you know, tree pollens could be through the roof, but if you're not allergic to it, then nothing happens, right?
Is there a way to find out which pollens you are sensitive to?
Well, I mean, probably you start coughing or sneezing on certain days, right? But yeah, I mean, you could go to the doctor and they can do like the scratch test where they figure out what types of allergies you have.
Okay. I guess then we're done.
Okay.
Thank you very much.